Hi guys, today we are discussing this special case, and as so many patients, they come to me in person, or they're gonna contact me on social media platforms, and they ask only one question: how many grafts do I need? This is big question, and whenever I have been in consultation with the patients, they ask the same question. I ask them, how do you come to know about the number of grafts and this thing? So they're gonna say me that we have been searching, we have been doing all these activities periodically with the fellow patients, and asking the same question from each other, that how many grafts they're gonna have to put in this bald area. So I was there to let you know as a whole, in a broader picture, how many grafts do you need in this particular patient. Before going for the number of grafts needed to this particular patient, we will discuss how many grafts he has lost from this whole area. So we will divide, we actually divide the this whole baldness in three parts, like front, mid scalp, crown area and transitional area. So if we're gonna calculate the number of grafts in the whole three areas, you will find more than 25,000 grafts have been lost from this area. So how many grafts do you need is some sort of different question, but the question should be how many grafts safely a doctor can take out of this donor area, this particular area. This should be the question. How many grafts do you need is a different question. Then I will ask, how many grafts have you been losing from this whole bald area, from the frontal scalp, mid scalp and crown area. And you see, if a patient on an average is having 90 follicular units per centimeter square, is any patient, I'm talking about the Asians and Caucasian and even patients from the Afro-American side. So if we have been discussing the number of grafts per centimeter square, I will take on an average like 90 follicular units per centimeter square. It means how many grafts he has been losing from this area. You can calculate the length and width of this baldness. The length would be like, maybe if I calculate in centimeters, it may be more than 30 centimeter long and maybe more than 12 centimeter wide. If on an average I say 300 centimeter square area is empty, multiplied by 90 follicular units per centimeter square, you will see 27,000 grafts have been gone from this area. With how much number you can compensate this area of 20,000 grafts. So question is, how many grafts safely you can take from this particular donor area. So I will go with another thing before discussing the baldness and before discussing the hair transplantation in this particular patient. The video should be a prolonged one. We should be discussing the procedures. We should be discussing how many grafts we can take safely from this area in different sessions. Like, it is not a one single sessional surgery. We can go for FUT, we can go for another FUT, we can go for FUE procedure, we can go for another FUE procedure. So how many grafts safely we can take from this particular donor area? Before discussing this thing, we need to discuss medical treatment of this hair fall. this baldness. Medical treatment means we should be thinking about the prevention of hair fall. Prevention of hair fall is more important than going for hair transplant surgery, because if we don't go for prevention of hair fall, what would be happening to him is he will keep losing more hair in this area, and baldness will be going more down, more deeper than on the back of the head. He will lose the hair from this area, he will lose the hair from this area, retroversion, from above down, he will be losing more hair in this area. So it does not make sense that we should not be going for, if we are not going for prevention of hair fall, we should be going for prevention of hair fall along with hair transplant surgery. So when we are discussing the hair restoration surgery, we should be thinking about medical restoration of hair fall. Then after that, or along with that, we can discuss the procedure of hair transplant surgery, which is needed as a first procedure for this patient, so that we can take a decent number of grafts from this particular area to cover this baldness. So keep in mind, this is not a this is not a single sessional surgery, this is multi-sessional surgery. Doctor should be thinking about multiple procedures like FUT, and he must be trained, he must be skillful, he must be having a good surgical technique to do FUT and FUE procedure for this particular patient in coming areas and in coming ages. And moreover, he must be going for prevention of hair fall in this particular patient. Thank you very much, boys.